This is Cox San Diego Connection. Welcome. Today we'll be talking about a subject that has been discussed quite a bit in the past few months, healthcare. You've probably heard about the Affordable Care Act, also known as Obamacare, and you're probably familiar with the term Covered California. In the next 30 minutes, we hope to give you some clarity, help you understand how it's all taking shape. Our first guest is here to discuss Covered California, our state's program that is insuring thousands of people. He is Dana Howard. Dana, thanks for being with us. Summarize Covered California for us.
Well, Covered California is the Affordable Care Act. A lot of people say Obamacare, but it is California's implementation of the Affordable Care Act, literally going to bring millions of people access to affordable health care coverage.
You were calling it a game changer. Why use that term here in California for people who don't have insurance?
Well, because for so long, people have not been able to have access to affordable, quality health care coverage. And if they did, they were subject to the whims of the insurance companies, whether they were going to say you're going to be denied because of a pre-existing condition, which in some cases has been something as so simple as a seasonal allergy. Or they have been beholden as far as how much they're going to pay. Rates going up on average 15 to 20% per year, and for many people, a whole lot more. Well, Incomes Covered California, and we're going to be able to, we believe, change much of that. Pricing, we think, is going to be more stable. There are health plans that have to bid to come into Covered California, and not everyone can get in. Not all the health plans can get in. We go out and we are what's called an active purchaser, meaning that we're going to go out and select who we believe are offering the best value for the consumers. So that when consumers come onto Covered California's website, coveredca.com, when they get there, they're not going to be deluged with 30 or 40 different healthcare companies to choose from, and then within them, 15 to 20 different plans. No, in California, we have 11 healthcare companies. In the San Diego area, there's 7, and so people will be able to go in and really make an informed decision, know that the benefits are going to be the same from plan to plan to plan. Whether it's Kaiser or Blue Shield or Sharp, it's going to be the same benefits. The only difference it's going to be is how much it's going to cost, and is the doctor and the hospital that I want to go see or visit in that particular plan.
How is the registration process coming along here in California?
It's going very well. A lot of people get confused with what was happening with the federal government. The federal government's getting their site together. They had some real obstacles because they had 34 states that they're trying to pull together, and not a one of them were being really cooperative in making sure that the Affordable Care Act got implemented within those states. But California has its own state-run exchange. That's what Covered California is. And so our registration, our enrollment has been going quite well, as a matter of fact. I mean, in the first month alone, in October, we were up to more than 30,000 people who had selected a plan. By November, end of November, it was up to 100,000 people practically, and that pace has kept going since.
Wow. How can people register? How can people enroll, especially if they have some questions and concerns about Covered California?
It's really simple. I mean, there are so many ways for them to get access. One, coveredca.com. That's the place to go to. It is the only website for consumers that is legitimate for Covered California. It's the only place where you can go, where a consumer can go to qualify or be eligible to receive premium assistance. That's financial help in paying for their premiums. And that financial help comes from the Internal Revenue Service, the IRS, is going to send a check every single month to the plan who that consumer selects as who they want to have their insurance through. So they can go through coveredca.com. They can also call one of our service centers. The 800 number is simple, 800-300. 1506, 800-300-1506. That's the number to call to get access to somebody who will be able to talk to you in your language and be able to get you enrolled. You can also go to one of the enrollment events or or that are being put on by enrollment counselors here. In San Diego area, we're having them at libraries. And so you can go to coveredca.com and check out which library here in this area is going to give you, is going to have an enrollment event where you can go in and sit down and talk with somebody in person. And you can also contact a certified Covered California insurance agent. These are insurance agents who have been selling health insurance for years. They've gone and gotten certified through Covered California to sell our products, and then they can come to your home, or you can talk to them directly, go to their office, sit down and talk with them at no charge. They cannot charge you a penny more than that premium costs, and you can get enrolled through them.
Well, you mentioned the IRS, and we've been conditioned to kind of fear the IRS, but in this instance,
the IRS is your friend.
Yeah, so in this case, they're our friend here?
Yes, indeed. So the IRS is going to give folks what we call premium assistance. It's all part of the Affordable Care Act. And so this isn't something for just low income or really poor people. This is something that's going to help middle-class Americans, middle-class Californians, working-class folks be able to get a leg up, to be able to have some help paying for insurance. Because let's face it, health insurance is not cheap. So it is not going to be cheap through the Affordable Care Act. It's going to be affordable, but it's not going to be just plain free for most people. So what the federal government is doing is saying, look, we realize this. We realize health insurance can be costly, but we don't want that to be a barrier for people to say, okay, I'm not going to do this. I can't afford it. It's just the opposite. They can afford it. And if you have a family of four, for instance, who is making less than $90,000 a year, they're going to be eligible for premium assistance to help offset that cost. Anecdotally, I've come across people with families of four where they have about $70,000 of adjusted gross income. That's adjusted. That's not their salary. That's the adjusted gross income, the money that you pay your taxes on. They come away with having $400 or $500 a month coming from the Internal Revenue Service directly to the health insurance company to help offset the cost of their premiums.
Well, good deal. Our conversation is far from over. We're going to take a short break and continue our conversation with Dana Howard of Covered California. So please stay with us.
Soon, Californians from Sacramento to Salinas to San Diego will have equal access to quality health insurance. Those who need financial assistance will get it, and nobody will be denied because of a pre-existing condition. Welcome to a new state of health. Welcome to Covered California. We are your health insurance marketplace. Enroll today at coveredca.com or call 1-800-300-1506.
This is my Contour, and it reshapes TV completely around me.
It knows everything I like and recommends new things.
Que me encantan.
And I can watch whenever,
however I want. Contour puts my personal favorites front and center, so I can search less
and discover more.
So my perfect show is always just a swipe away.
This isn't TV for everyone.
Contour is TV just for me.
Introducing Contour, only from Cox.
Welcome back. We're discussing Covered California. It's our state's program that is providing health care to many who can't afford it. Our guest is Dana Howard of Covered California. Let's talk a little bit about the benefits involved with Covered California. Tell us about those and how they can really help people out.
Well, the great thing about the Affordable Care Act is that it delivered what we call essential health benefits. And these are standard that all health plans that are offered through the exchanges must have to be able to comply with the law. And so no longer are people going to have these health plans that are what we call skinny or skimpy, that just go to try to use them and you'll find out that you may have been paying just $75 or $100 a month, but you're not getting anything for that. So gone are those days. Yeah, you're going to have to pay a little bit more, but you're going to get a whole lot more when it comes to benefits, real stuff, including preventive care, where you can just go to the doctor to find out, make sure, am I okay? Everything okay here? So that's a really important aspect of this as well. But on top of that, the benefits are going to be what is called uniform or standardized within Covered California, so that you know that you're getting one thing from the next to the next. On top of that, what's really great is that there are tiers of benefits, so that if you know that you're going to be going to the doctor a lot, you can choose this platinum benefit. It's going to cost a little bit more up front, but you're going to pay less when you go see the doctor. And then you can come down to what's called a gold level, from platinum to gold to silver. Most people are going to be in that silver range. That's the one that they've been familiar with most likely if they have had employer-based insurance before. And you can go down to a bronze plan, that if you know that, you know what, I don't mind paying a little bit more when I go see the doctor because I don't go that often, but I'm going to pay less every month. And so it gives the consumer the flexibility in still having really, really good benefit, robust benefits.
Sure. There's a couple deadlines that have come and gone. There's one approaching at the end of March. Tell us why it's very important, and is it a now or never sort of thing with this deadline in March?
Well, you are going to have to get insurance. That's the law now. January 1st, you're going to get a pardon for the 3 months. January, February, and March if you don't have insurance for them, but for that period. But after that, there is unfortunately a penalty that's going to be involved, and it's not just $95. That's the least amount. It is 1% of your income, or $95, whichever is greater, whichever is more. So you have somebody making $30,000 a year, they're going to have a $300 penalty if they don't get insurance that's really affordable. And so, especially at that kind of salary, you're going to be able to get some premium assistance to help you. So, you know, people are going to have to make that decision. Do I want to take a $300 penalty and get nothing? Or do I want to spend $300 and really get some really strong health insurance? So the deadline is going to be March 15th, because after that, you can still enroll between March 15th and March 31st. However, after March 15th, you're going to be subject to a penalty because you won't have insurance in place at the end of March 31st. You won't be able to have insurance in place until May 1st, because the 15th is the cutoff to have insurance in place the following month. Now, after March 31st, you're going to have to wait until open enrollment starts again in October of 2014. So people really need to know that they've got to get this taken care of within the next few weeks.
As we sort of wind down here, you're telling me that you've been surprised by the number of younger Californians signing up, but you want to encourage even more to do so.
Most certainly, because right now the number of people who are under 35 and signing up for Covered California is really in line with their population here in the state. It's a really strong match, and that's really encouraging. But we want more people who are younger to sign up. You know, there's a lot of talk about, well, you have to have young people to be for this to be a success, for it to be a successful risk pool. Well, yeah, that's correct. But right now we're in that match. But what we want to be able to see is more young people coming into this, because we know that there is a history of young people not having health insurance. And the next thing you know, something does happen, something unexpected, an accident, or they have a really unexpected illness that takes place, puts them in the hospital, and then they are saddled. Either their parents are going to pay for it, and send their parents into financial despair, or the kids themselves are going to be in bankruptcy. And medical costs, that's the #1 reason for bankruptcy. So we want to encourage folks that, yeah, I know that you feel healthy and everything looks great, but be prepared. It's no different than having car insurance. You don't just drive down the road without it, because you never know when an accident might happen. Well, the same goes for health insurance. You don't know what's going to be in your health future. And so you want to make sure that you are prepared, and you can do it now affordably through Covered California.
Okay. Thanks, Dana, for being with us and giving us a little lesson on Covered California and why it's so important. Appreciate it.
Great. I hope to be back soon.
All right, you got it.
All right.
And as we move along with Cox San Diego Connection, we'll meet Michael Murphy with Sharp Healthcare. He'll talk about medical care in this day and age. We'll be right back. Please stay with us.
Soon, Californians from Sacramento to Salinas to San Diego will have equal access to quality health insurance. Those who need financial assistance will get it, and nobody will be denied because of a pre-existing condition. Welcome to a new state of health. Welcome to Covered California. We are your health insurance marketplace. Enroll today at coveredca.com.
Welcome back to Cox San Diego Connection. The topic is healthcare, its current state and its future. Sharp Healthcare is a major health provider in San Diego and is already working with the federal government to provide medical care to just about anywhere. Mike Murphy runs Sharp Healthcare and is here now to join us. Tell us a little bit about Sharp Healthcare and how it's just evolved into this giant healthcare provider here in San Diego.
Great, thank you, and thanks for having me. Sharp's been around in San Diego since the mid-1950s, and we've grown from one single hospital in the 1950s to now we have 4 acute care hospitals, one in Coronado, one in Grossmont in the East County, Chula Vista, and then in the center of the city we have the Memorial Hospital, the Mary Birch Hospital for Women, and Mesa Vista Behavioral Health Facility. We are the largest provider of healthcare services in San Diego. We have 2 affiliated medical groups, Sharp Community Medical Group and Sharp Reeve-Stealy. And actually, we're the largest private employer in San Diego with over 16,000 employees and over 2,600 physicians on our medical staff. And we supply about 28% of the health care for San Diego County.
Wow, and in surveys, you always do well. People are very happy with Sharp Healthcare, so that says a lot. Now, Sharp is a member of the Pioneer Accountable Care Organization. Tell us about that and why you became a member.
Well, the Pioneer Accountable Care Organization actually was one of the things that was passed in the Affordable Care Act. Many people think this act just is happening right now because of the publicity that's happening now. But the law passed in 2010, and in 2010 they did ask for organizations who had been doing things aggressively in managing care to deliver on the triple aim and that had success in it, organizations like Sharp, to come forward and join what they called Pioneer Accountable Care Organizations, where we actually take responsibility for a population of Medicare fee-for-service patients, and that we actually are rewarded for managing the care across the entire continuum, which is one of the actually pushes of the Affordable Care Act, is how do we manage care across the entire continuum so that we keep people out of hospitals rather than only being paid for when a person comes into a hospital, that we're incented to work with the population across their entire continuum of care, keep them healthy, manage their chronic conditions, keep them out of the hospital. And it's a pilot to see if we can actually bend the cost curve. They asked for applications. They had 60 some odd applications. They actually chose 32 organizations. We're now in the 2nd year of the pilot. It's a good learning, a good application, and like a lot of the Affordable Care Act, it is kind of how are we going to learn and how is this going to evolve to actually create a better healthcare system in the long run.
For a long time, you've insured large groups of people, large employers, small employers. Now you're doing individuals. How will you make all this work?
Well, as you noted, since 1991, we are one of the organizations, of the few provider organizations that actually has its own health plan. So we've been selling health insurance here in San Diego to employers since the 1990s. And we have about 70,000 members in there. And we've been successful in doing that because we provide a great healthcare experience. We manage the care across the continuum, and we think we do it at a very affordable cost, so we have been continuing to grow. We've never sold an individual product, but with the Affordable Care Act and these exchanges, which are getting a lot of attention, obviously that's geared primarily right now around individuals. So we took the opportunity to say, well, let's expand what we've already done very successfully in the employer market and begin to offer it to individuals. So it is new to us, and we are now offering an individual product on the exchange, and we're excited to do that and think we'll be very successful because it's what we've been doing in delivering on high quality, cost affordable care with a great experience for patients and families.
Will the Affordable Care Act change in any way, shape, or form what you do at Sharp already for people?
Well, the Affordable Care Act clearly has changed lots of things in healthcare, and as I say, even though most of the public attention is actually happening right now around the exchanges, really since the law passed in 2010, things have changed. Ones that are pretty obvious that people maybe forget was, now you can cover your kids up to age 26 on your employer's policy. It's been changing for healthcare providers that we have new incentives related to limiting readmissions, providing higher quality of care. You're rewarded for quality outcomes. So it has changed and will continue to change. But I think the real emphasis, however this law continues to evolve, is how do we deliver on what really is the triple aim that was in that Affordable Care Act, which is how do we deliver better health to the whole population of a community, the whole population. how do we deliver better quality of care? So how do we make sure that we're delivering the right quality of care at the right place at the right time? And how do we bend the cost curve? Because the reality is, even before the Affordable Care Act, we can't go back there. The model was not sustainable for us as a country. The cost of health care, we need to do things to address the cost of health care. Whether it's this act or the evolution of this act, we need to address it, and we want to be part of that solution.
Politics aside, and you're right in the cusp of everything, how do you see the Affordable Care Act evolving over time, and how will it work for people and for corporations like yours?
Well, I certainly don't know that I can predict how it will evolve over time, and actually I wouldn't have predicted some of what's happened even in the last 12 months with the president delaying the employer mandate piece. I would not have predicted that. The challenges that are happening with the exchange, I would not have predicted that. But all of this will evolve, and I guess I'd go back to what's happened really. Medicare passed and was actually formed in 1965. Well, the Medicare law has changed all the time since 1965. Laws change and adapt. When they're not working, then we try and figure out how can we make them work. Clearly, the Affordable Care Act has had things that have worked successfully, and clearly right now there are things that are not working as well as people intended. And I would suggest that that's going to continue for a number of years. And we need to be a nation that's smart enough to look at this and say, this isn't working, how do we need to change it? Because we need to continue to address delivering really on that triple aim, which I think is a good aim. Better health for everybody, better quality of care when you need it, and at a cost that can be affordable to us as a nation.
Well, thanks for being with us, and as a member of the Sharp Healthcare family, as a patient, thanks for being with us, and I'm really proud of what you guys do over there. Thank you.
Well, thank you very much, and thanks for selecting Sharp. We're proud of what we do, and we look forward to continuing to take care of this community.
Sure, thank you, thank you. There's a lot more to come on Cox San Diego Connection. We just heard from one of the leading healthcare providers in the state. Now get to hear from an up-and-coming system that you've probably never heard of before. Please stay with us.
Soon, Californians from Sacramento to Salinas to San Diego will have equal access to quality health insurance. Those who need financial assistance will get it, and nobody will be denied because of a pre-existing condition. Welcome to a new state of health. Welcome to Covered California. We are your health insurance marketplace. Enroll today at coveredca.com or call 1-800-300-1506.
This is my Contour, and it reshapes TV completely around me.
It knows everything I like and recommends new things.
Que me encantan.
And I can watch whenever,
However I want. Contour puts my personal favorites front and center, so I can search less
and discover more.
So my perfect show is always just a swipe away.
This isn't TV for everyone.
Contour is TV just for me.
Introducing Contour, only from Cox.
You're watching Cox San Diego Connection. It's time to learn about the little healthcare engine that could. The San Ysidro Health Center has become a major player in the healthcare industry in San Diego. While its name implies a single facility, it's actually a big network. To learn more about it, let's talk to Leticia Cáceres, the center's director of outreach. Leticia, welcome. Tell us about the San Ysidro Health Center and how it's just evolved and grown over time.
Well, the San Ysidro Health Center has a special story. It started in 1969. A group of women, community members in San Ysidro, felt that there was a need for health care and wanted to provide that. And so they opened up a little house in San Ysidro on Bayer Boulevard and started providing basic health care services. And over time, since then, almost 45 years later, we have grown into about 9 clinics, several mobile health clinics around the South Bay, Central area, and Southeast San Diego, serving over 85,000 patients.
And it's great work that you're doing. Now, you decided to get involved with Covered California. Why did you do this, and how are you helping get people registered?
Well, San Ysidro's mission is to protect, promote, and improve the community health. And this law and Covered California does just that. It promotes and improves the community health by expanding healthcare and providing access to quality healthcare and more affordable healthcare. So San Ysidro currently serves almost 97% low income, making under $44,000 for a family of 4. Many of these are uninsured. Many of these have gone without care for many years. Some have never had health insurance. And so this law, and with the expansion of affordable health care, they will now be able to get the health care that they need. And we're very excited about it.
And you guys are being very aggressive. You're going after people, you're recruiting, you're not just sitting back. How are you going out there and signing people up?
Well, with Covered California, we are what is called a certified enrollment entity. We're also certified educators, and we have over 25 staff who are trained and certified by Covered California to go out into the community and provide health education as well as enrollment services. We have been out since August providing information all throughout the community at health fairs, at local organizations, at libraries, at college campuses. We also have a hotline, which is 619-600-3000, and that is specifically for information on the Affordable Care Act as well as Covered California. And on that hotline, we're able to determine eligibility for the insurance plans offered through Covered California. We are also now enrolling people, and we are assisting people at all of our clinic locations as well as our community partner locations, libraries, college campuses, and other entities.
There's a misconception that you might be pushing people towards one plan or one healthcare provider, but you're simply providing options, right?
Yes. We are not allowed to what is referred to as coaching, and we do not sway anyone into any particular plan. Our mission is to get people insured, period, and whatever plan fits with their needs is the plan that they can choose.
Now, the dental care coverage is now available, where there's been a few years through Medi-Cal where it kind of went away, but that's coming back, especially for younger people. Tell us about that.
Yes, in the 2009 budget negotiations, Medi-Cal dental services were cut, and most recently, a law was passed in June 2013 that basically brings back Medi-Cal dental services, which is something that many of our senior population and children have gone without for years. So this is a very exciting win for California, and in particular our patient populations who have been needing dental services for quite some time.
How can they reach the San Ysidro Health Center? A website perhaps? What's the best way to reach you, and then so that people can get help?
They can reach us by calling our hotline, 619-600-3000, Monday through Friday, 8 to 5 p.m. They can also call our main line, which is 662-4100. And either way, they are going to get somebody on the line to direct them and possibly set them up for an appointment with one of our counselors.
And as we wind out our conversation, what's ahead for San Ysidro Health Center? You're expanding the dental care facility at Rady Children's Hospital. How soon can we see that?
Yes, we are. We are expanding dental care services at Rady Children's Hospital. We currently provide services to the more needy children, those who are sick, and we are expanding that to include all children. And so that's exciting. We also have dental services at several of our locations. Our King Chavez Medical Center in Southeast San Diego, also our new location in Chula Vista, the Chula Vista Medical Plaza on 3rd and J, as well as San Ysidro, the main clinic on Bayer Boulevard. So we are expanding dental services because we know that that's a service that the community needs.
Leticia Cáceres, thanks for being with us.
Thank you.
All the best to you.
Pleasure.
I'm Salvador Rivera, and on behalf of our guest and all the employees of Cox Communications, we want to thank all of you for watching Cox San Diego Connection, helping you learn and prosper.